you.
Thank you, Kamal, and thank you for giving me this opportunity to speak today. Just wanted to echo a lot of what Gary said in terms of the fantastic goodwill that's taken place across West Berkshire over the last 5 months. It's been fantastic during exceptionally difficult times. I'm not going to dwell too much on COVID-19. There's lots of opportunities to hear more about that in our public local outbreak engagement boards, but I just wanted to give you a bit of a summary really about where we are in West Berkshire in terms of the current health status of our local communities and our population, talk a little bit about what's worked well, and then some of our ideas going forward, but also some of the challenges that we might have, not only during COVID-19, but also after the pandemic, which we need to start thinking about planning for now. So actually flows on nicely from what Gary just talked about in terms of what does health and well-being mean. And this is a quite a theoretical definition, but I think it's always well put in that health is about a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And the key things for me is that we always tend to focus on physical health, and we need to give equal weight to our mental well-being, our social well-being, how we connect with each other and our communities. So it's always important when we think about health that we think not just about health services, but our communities that we live within, and how we connect with each other, supported whether that be by the state or by the voluntary and community sector. And this diagram illustrates that point, and we often talk about this in public health. And it looks at all the different kind of influences on our health and well-being in terms of education, the work environment, living and working conditions, and employment, healthcare services, housing, and all these things have a role to play on our health. Importantly, healthcare and the NHS actually played a very small role in terms of our overall health and well-being. So whilst we have a significant focus and we always welcome the support the NHS brings us, we know that actually there's many different things that influence our health and well-being. Also, I forgot to introduce myself, by the way, so apologies for that. So my name's Matt Pearce. I'm Head of Public Health and Wellbeing at West Berkshire Council. I think what we do have to do is think about is the inequalities, though, that Kamal just talked about. And there are inequalities in West Berkshire. We are a relatively affluent district, one of the most affluent districts in the country, in the top 20%. But we know that inequalities exist. And between the most deprived and most affluent areas of the country, there's between a 4 to 5 year gap in life expectancy in terms of how long we live. And what COVID-19 has done is actually shone a light on some of those inequalities and some of the risk factors for people that may suffer serious consequences from getting COVID-19. So we know that older people are at risk. We know in gender, we know that men are twice as likely to die from COVID-19 as women. And we also know that underlying health conditions are important. So unfortunately, those that have sadly lost their lives, many of them have had long-term conditions, such as cardiovascular disease or respiratory disease. And some of these can actually be preventable, but they're often felt by the poorest in our communities. There's also been lots of conversations and discussions around ethnicity in terms of the BAME community, the Black ethnic minority population, in terms of how they're feeling the consequences more so than other individuals across the population. So we need to think about how we support those individuals. And then also deprivation. So we know that those that died from COVID-19, people from more deprived areas were disproportionately affected. So inequalities exist in us and around us everywhere. As I said, we're generally an affluent district, but we need to think about those that suffer ill health more so than others. So I think it is important to reflect about some of those challenges that we do face as a district. As I said, we are generally healthy, but there are some things that were challenges prior to COVID-19, and that the work of the board and others that continue to strive and tackle. These are things such as healthy eating, in terms of concerns around obesity, alcohol consumption, physical inactivity, and smoking. And we've already talked about lots around mental health and well-being. And we know that 1 in 4 of us will experience a mental health issue or concern any time in a year. So again, whilst we don't necessarily experience high mental health issues in West Berkshire, it's very common that many of us do experience them. School readiness is an area of concern for West Berkshire as well, in terms of those who are eligible for free school meals. So ensuring that those that start school are able to and have sufficient competence levels in terms of their ability, their academic attainment. And then inclusive employment, so the gap in employment rate between those with long-term health conditions and the overall employment rate. We know that those people find it harder to get into employment than the overall employment rate, and that's something we want to look at. I've talked a bit about people with multiple long-term conditions. As we have an ageing population, we do have a high number of individuals with long-term conditions. And then the other concern for us is hospital admissions caused by unintentional and deliberate injuries in young people in terms of self-harm. So another area of concern that was flagged. And then oral health. So 1 in 4 children have decayed teeth. And again, it's often a hidden statistic, but something we need to focus on. And as we move on through the pandemic and post-COVID-19, we think there might be other things that we need to be aware of communities. Many of us have experienced some of these issues already, and there might be consequences further down the line. I'm not going to go through all of those, but it's something we need to think about, and how we can draw on all our partners and assets to help address some of these potential issues along the road. We all have a part to play, and it's ensuring we understand what that role is in supporting one another. In terms of all the positives that have come out of West Berkshire, and there has been many in terms of the COVID-19 response, many of you will have hopefully have heard about the Community Support Hub, brought together with a partnership with a number of those people on this call today, working alongside the council, supporting the most vulnerable, distributing food parcels, and connecting people to community groups, working closely with Gary and his organisation. And we're going to keep that support hub running as long as we need to. Many of you will be aware that the number of cases are rising now, and we need to ensure that that support is in place for the foreseeable future as and when is needed. Also going forward, it's critical that we continue to communicate with everyone about the latest COVID-19 position, where people can go to get support, but the latest guidance and advice, and also keeping our workforce safe. So the council has had a key part in coordinating the provision of personal protective equipment, whether that's face coverings, face masks, and other type of equipment. And then testing is another big issue that we're really working to support. We recognise those current challenges across the district at the moment, and we're working hard with our national partners around that to make sure that people, if they do have symptoms, then they get a test. And then, as I said, we're working with partners around care home and other settings where we feel that there might be more concern and risk to those settings around COVID-19. And then finally, we're supporting local businesses and community groups. And I know that Nick will go on to talk about that in a second. This is a diagram which I'm really fond of in West Berkshire. And again, although it has been a really challenging time, and COVID-19 has been difficult for people, particularly those that have sadly lost their lives, there are opportunities that we can take from COVID-19. As I said, we already had quite resilient communities, but there are good things we can take from this. And that's whether it's improved air quality from people not taking their cars or as much traffic on the road. It's around shopping differently, using local food systems. It's about people being more active, connecting with nature, connecting with green space on their doorstep. For some people, it's about improving work-life balance, working home for more, spending more time with families, less commuting. But then it's also using health services more appropriately, looking to our neighbours for support and advice. So these are something we really want to hold on to as we go forward in West Berkshire, and something that you may want to talk about over the course of this event. So finally, what are we doing now? So many of you might be aware, we have developed a local outbreak control plan. We are working really hard to keep everyone safe in West Berkshire. The immediate risk is COVID-19. But as I said, we recognise that there might be some challenges that come with that, and unintended consequences from people not treating their conditions or seeking health advice when they need to. But it really is important that they do. There's a draft recovery strategy that's gone out through the council, again outlining how we want to go forward with our partners in recovering from COVID-19. And also working with all our services as best we can, making sure they do stay open and supporting those people that most need the help. And as I said previously, we're looking at continuing to operate our community support hub, but also grow on all the good work that has been done through those community groups, and ensure we engage further with our communities. And then finally, what we're looking to do is lots of strategies being published within the local authority at the moment alongside our partners. And we want to make sure that health is embedded through all those different strategies, whether it's through the environment strategy, cultural strategy, homelessness strategy, and economic development, so that health just runs through everything we do, because it is so fundamental. Last but not least, I just wanted to flag that we are in the development of a new joint health and wellbeing strategy. This is working with our partners Reading and Wokingham. And over the course of October, November, we will be looking to seek voices from our community partners, from our communities, the public, to help shape what is important to them. And hopefully a lot of the feedback we get from this event and your contributions will help go on to inform that strategy. Thank you very much.